Welcome health professional educators from the DFCM HPE community of practice. You have indicated that you are involved in the teaching of our residents, and we want to thank you for the important role you play in facilitating learning for both pre-licensure and post-licensure students at the DFCM teaching sites. Over the past year, the DFCM has been working on enhancing the assessment processes for teachers and learners with the aim of enriching the experience and the feedback that residents receive during their 2-year family medicine residency at the University of Toronto. One component of the assessment process involves the completion of field notes by preceptors, teachers, and residents on their clinical experiences. Traditionally, field notes have only been prepared by residents and medical preceptors. However, to further support interprofessional care and collaborative practice exposure, the DFCM is keen to expand the opportunity of field note completion to HPEs who are actively engaged in teaching family medicine residents. HPEs are being strongly encouraged to contribute in a formal way to resident assessment through participating in resident review sessions and through completing field notes. Many of you are likely unfamiliar with field notes and how to utilize them in the assessment process of residents. In order to support the enhancement of your teaching role and contribution to assessment, we have prepared this module available online and at your convenience. At the end of this training module, we are asking that you take a few extra minutes to complete an embedded Qualtrics survey regarding the module. The survey is the first part of a 2-step evaluation process for us to determine the utility of this module in assisting you to complete field notes. The second part of this evaluation will take place later in the year and will involve reaching out to a number of HPEs who have completed the module, asking them to participate as key informants for us to enrich our understanding of how implementing field notes has worked for HPEs. You will be provided with further information about the study at the end of this module. You are not required to complete the study or to participate in the study, but we hope you're able to do so. The information we learn from the study results will help us to continue to support HPEs and the DFCM in their teaching and assessment roles. My name is Deborah Kopansky-Giles, and I'm pleased to co-present this learning module with Volkan Leung, who has been involved in the advancement of resident assessment procedures in the Family Medicine Residency Program. We're both employed part-time by the DFCM, but have no conflicts of interest with respect to the presentation of this module. Why competency-based medical education? Competence is the integration of knowledge, skills, attitudes, values within a specific context. Another way of explaining competence is doing the right thing at the right time, in the right way, in complex situations. It includes an array of abilities across multiple domains of a health practitioner's performance in a certain context. It is dynamic in that it changes over time, experience, and setting. Competency ensures that the graduating health provider can work capably, appropriately, and safely with patients in their future practice. An example of what competence would look like in a clinical scenario is, for example, being able to construct appropriately thorough differential diagnosis list related to common symptoms that is congruent with the data generated by the history and physical examination and weighted according to probability. The competency is to demonstrate evidence-based knowledge of the common diagnosis in creating a differential diagnosis. The College of Family Physicians Canada Standards of Accreditation are outlined in the Red Book. The standards require an effective, organized system of assessment for residents and a mechanism to ensure residents have regular opportunities to review their performance and progression. It is our hope that this module about how to utilize field notes in resident physician assessment will provide you with an opportunity to better understand the DFCM system of resident assessment, to become familiar with how to complete field notes, and to understand how field notes can complement other forms of assessment. This slide is a quick overview of how we have moved to assessing competency and levels of trust utilizing an outcomes-based approach. This approach is rooted in observation and the demonstration of desired skills, behaviors, and attitudes, similar to the approaches all teachers take when supporting a health professional trainee in their clinical experiential learning. Entrustment scales help to enable the determine of what level supervision of the residents is required at that point in time. A little later in this presentation, we'll show you the entrustment scales. CanMeds FM outlines the following competencies that all family medicine resident physicians must attain in order to be competent to practice independently. These include family medicine expert, health advocate, scholar, professional, leader, communicator, which is focused on interactions with patients and families, and collaborator, focused on collaborating with other professionals and team members. Competency-based medical education enables better validity and reliability in assessment of learners, thereby being more helpful for learners to be able to understand where they are in their learning process, how to reflect on this, and how to work towards attaining higher levels of trust towards independent practice in a graduated fashion. Historically, we've seen that preceptors may have a difficult time failing a learner. There are multiple reasons why this may occur. However, assessing students' progress through competency-based approaches assists preceptors in making more accurate rankings of learners. In the old field note system, it was very hard to say a resident was below expectations. Sometimes faculty may be afraid to give a low rating. What are the repercussions to residents and preceptors? In the old field note system, below expectations was also a warning flag for program directors to intervene. When traditional anchors are replaced, as in the new field note system, with anchors based on entrustment, raters are more discriminating of training performances and the reliability of ratings significantly improves. Experience with entrustment anchors suggests that clinical raters are more likely to provide honest ratings and that trainees are more willing to accept lower scores if these are accompanied by concrete verbal and written feedback required to improve their future performance. While direct observation is ideal, a field note can be completed on a partly observed or reported encounter, as well as many non-patient encounters, such as following up on results, going the extra mile after hours, or not responding to emails in a timely fashion, as examples. This enables the preceptor to have more flexibility in using different ways to evaluate trainees' skills, behaviors, and attitudes. Many of you may already be familiar with Miller's Competence Triangle, which helps to guide teachers in supporting their trainees to attain competence and reaching the doing level competently. Many of the ways we currently assess learners, such as multiple choice questions, assigned projects, and so forth, do not get at what a trainee does on a typical clinical day. We need our faculty to understand the importance of assessing trainees in the real clinical environment so that we can ensure that they perform competently there. Every health professional training program needs to meet a list of standards broken down by requirements and indicators which can demonstrate a learner's progress through the program. The best way to demonstrate feedback and assessment is through a standardized and evidence-based documentation process, such as the field note system. As we are moving further and further into team-based collaborative care models, it is important that our learners have the opportunity to learn from non-physician educators. HPEs are also able to provide a different perspective to residents and preceptors about how well the trainee can work on the team. This is why the DFCM feels it's very important for HPEs to participate formally in resident physician assessment and is encouraging all residents to have a certain percentage of field notes completed by HPEs. Field notes can be based on fully observed or partly observed clinical interactions, reported interactions, or not related to a specific patient encounter at all. Field notes are done in real time, which facilitates better retention and documentation of the observation. They are user-friendly. They can even be done on your phone now, and they contribute to documenting where the learner is in their level of competence or trust. You can only do one CanMeds role or entrustable professional activity, EPA, at a time per field note. However, you can assess different EPAs based on the same encounter you are observing. For example, while observing a clinical encounter, you can assess the communicator role on one field note and the professional role on a second field note, if appropriate. The more field notes that are completed per resident, the more reliable the assessment result will be, and this improves the ability of the learner and their preceptor to facilitate competency attainment. So some of the examples we've talked about are shown on this slide where a field note can be completed. For example, you can observe a trainee giving an oral presentation. Observing that can help you in evaluating the level of expertise and or level of professionalism. You can also think about a field note being completed as a summary of a clinical day. actually giving feedback on a specific procedure that's been observed, or again, providing feedback on what a resident might have learned or reviewed and brought back to you as a preceptor.
So how are field notes used? Well, we know that residents should be using them for self-reflection to really help identify different areas of weakness and follow development over time. For the preceptors, this allows us to track the various CAN-MEDS roles that they've been looking at, as well as to really build documentation for learners in difficulty, as well as identify areas that they need a little bit more work on. The field notes are really used to help triangulate assessment information to help inform the completion of ITERs. And the ITERs stands for the In-Training Evaluation Reports, and that's the end of rotation higher stakes assessment. Field notes are also used to inform the 6-month progress reviews, which are longer discussions that each of the residents have with their site directors. One of the important questions that we are asked on a routine basis is, how many field notes should be written? Well, the answer here is a little bit more complicated. And the answer really is they should have enough field notes. So it depends on the stage and phase of the particular trainee. Trainees earlier on need more. Trainees in difficulty need more. And what we're really aiming for is more than 3 per block. Why? Because we know that we need more than 1, for example, more than 1 field note to be able to triangulate in order to have a fulsome in-training evaluation report, or ITER. Over the last little while, we've had a number of enhancements to our field note system. It's moved to a new platform which allows it to be completed on a mobile device. It also has allowed us to make it more resident driven, and we've added the use of different entrustment scales, which you'll see at the very end of the field notes. There are 3 ways, each with a different purpose, that a resident can initiate a field note. Firstly, it can be self-assessment, where the resident completes the note on their own, and they then receive a notice that the field note was completed. The second would be the resident initiating the assessment, where then an email is sent to the preceptor for modification, approval, and sign-off. Thirdly, the resident can send a prompt. So this again would be an email sent to the supervisor or preceptor to complete an assessment. The resident once again will choose a particular CAN-MEDS role. And in this case, the residents can send the information that's not part of that field note. So for example, the particular presentation of illness to help remind the preceptor about the case itself. At the very bottom, you will see the actual message that is received via email to fill out that field note. The new software platform for field notes allows you to load this up and fill it on your phone. So here you can see links that allow you to understand how to link this together with your iPhone or your Android phone. Over the next several slides, I'm going to walk through how a resident prompted assessment works, where the resident sends a prompt to the supervisor, assessor, or evaluator, or HPE, to complete the assessment. So these next several steps are the steps taken by the residents. They first go to the departmental website, and then they enter their University of Toronto ID, or UTOR ID. You yourselves, if you have this, you can enter it and actually see a portal that will provide you a summary display of the various field notes that have been created. But these are the actual steps that the residents take to start the creation of a field note. At any time in the actual field note creation process, if you need any assistance, here is where you go. There's also a user manual that's been created, as well as websites and an email that goes to the help desk. So once in the field note system, the resident is going to click on the Start Assessment button, which will then allow them to actually click and select an assessor. Next, they're going to click on the little circle there with a plus sign that says Add External Assessor, and then input the actual assessor information in those text boxes, and then hit the Add button. Next, they will have this particular screen where it allows them to select the date of the encounter, the assessment method, so in this case it's going to be to email a blank form, and there will be a few other options here. Importantly, they should not change that stage of residency box. After all that's set up, you will then be met with this slide that says Start Assessment. When you click on Start Assessment, you then can choose an entrustable professional activity. And here you can see we have the various CanMeds FM roles with some of the 6 skills of the family medicine evaluation objectives also added in there as well. The penultimate step of the field note rating would be to actually choose one of these rating scales. You can see here there are the words as well as a brief description of them, and this has been taken from the modified Ottawa score. We also strongly recommend that the narrative boxes have some good comments. We very much encourage you to fill out these narrative comments to comment on the observed presentation, provide suggestions for improvements, various action plans, and be as specific and behavior-based as possible. We know that residents very much appreciate these narrative comments. I'm going to spend a little bit more time on this slide. This gives examples of good comments. On the far right-hand column, you can also see the overall entrustability that has been assigned to this particular trainee. There can be some variability in how individuals rate the overall entrustability, but I think the more important piece here is to look at the actual comments themselves. These have been selected from many different field notes that have actually been sent to trainees, and they've been selected because of the richness of the commentary that's been provided. You can see here there are comments that are very specific. There are certain recommendations and considerations for improvement, and these are the types of comments that trainees and residents very much gravitate to.
On this slide, you will find some additional resources that can help further support your understanding about the assessment process for family medicine residents. You can also find more information available on the DFCM website. Thank you very much for taking this HPE Field Note training module. We hope it has been helpful in your understanding of how field notes contribute to the assessment of trainee competency. If you have further questions, please do not hesitate to email us at the email address on the screen, and we'll get back to you shortly. As mentioned at the start of this presentation, we would be very appreciative if you could take 5 to 8 minutes of your time now to participate in our study. More information is included on the following slide. We'd like you to complete the survey embedded on that slide so that we can better understand your learning needs around assessment of family medicine residents. Thank you very much in advance for your participation, and have a great day.